Hello, I'm J Keckstein, and I want to thank the organizers inviting me to this Congress. And I'm very sorry that I cannot be online during the Congress, but I hope you will enjoy this presentation on the new hashtag classification as a comprehensive classification of endometriosis. When we talk about endometriosis, we want to describe it. And there are several possibilities. We can make a laparoscopy and we can describe it by a report, narrative or structured report. We can make pictures or videos. We can do sketches to document the disease, or finally, we want to classify the disease. So when we look back, the most used classification is the AFS-RSRM classification, first described in 1979. Then for deep endometriosis, we have the Enzian classification. And in infertility patient, we use the EFI, which is a calculation model to make a prognosis on the fertility rate in patients with endometriosis. Let's have a look at the RSRM classification. It's a very sophisticated system used by laparoscopy or laparotomy, and it describes the various lesions. And finally, we have stages, which are calculated by numbers. And these numbers come out of the size and lesion locations. We judge the peritoneum, the uterosacral ligament, we look at the ovaries, we identify adhesions in the pelvis, but we do not identify bowel endometriosis or bladder endometriosis or adenomyosis or ureter endometriosis or other localizations. In this case, you can see adhesions and severe endometriosis in the cul-de-sac between the uterus and the bowel. Lesions there and there. How can we describe it with the RSRM classification? It is not possible. In that patient, we did also a bowel resection because of deep lesions in the rectum. You can see here the specimen with a nodule in the rectum. We know that RSRM is commonly used, but unsuitable for deep endometriosis. For that reason, the World Endometriosis Society and other recommendations say that we should use, in addition, the Enzian classification in case of deep endometriosis. What is the Enzian classification? It's a very detailed description of lesions in the pelvis. The A, B, and C are the different compartments in the pelvis. The A compartment is the rectovaginal space and vagina. B is the uterosacral and the cardinal ligament on both sides. And the C is the rectum. And according to the size of the lesion, we gave the number 1, 2, and 3. In addition, with the Enzian classification, we describe the FA. FA is the adenomyosis, and FB, the bladder endometriosis, FI for intestinal endometriosis, and FU for the ureter. And other localizations are then described by diaphragm, lung, and nerve, and so on. This is the original Enzian classification. Let's have a look on a bowel specimen which has been removed because of severe deep endometriosis. Where the deep endometriosis is hardly to identify in this case. Opening the specimen, you can immediately see the deep lesion in the rectal wall, a long distance, more than 7 centimeters. We could do the bowel resection because we knew it in before surgery. With the ultrasound, you can identify the thickening of the bowel wall, and we can classify this. Using the Enzian classification, the C compartment, longer than 3 centimeters, is called Enzian C3. In recent years, more sophisticated identification of endometriosis by ultrasound became very popular. The very interesting and very good paper of the IDEA group shows and demonstrates how each lesion in the pelvis can be described and identified by ultrasound. So this has changed since 1979, when ISRM was published the first time. We have now better surgery, better diagnostic, better technology, interdisciplinary surgery, robots, ultrasound machines, MRI, and fusion of both. For that reason, we describe endometriosis in addition to the ISRM with Enzian. We describe it with the IDEA criteria, and for the adenomyosis, the Muser criteria. We can use it as a preoperative description, intraoperative, or postoperative. Now, the hashtag Enzian now is the next step of the Enzian classification. We add the peritoneum. P is the P for peritoneum. We describe the ovary with O. We describe the adhesions with T. And according to the Enzian compartments, A, septum rectovaginale, B, uterosacral ligament, C, rectum. This is bladder, FB, and FA for the adenomyosis. Now, combining the established classification are now in one classification together. This is the hashtag Enzian classification. The hashtag classification includes deep endometriosis, as I demonstrated already, and the peritoneum, the ovary, and the tubo-ovarian condition. So all anatomical structures are described. And we describe it not in stages, we describe it in detail with a code. It looks very difficult, but it isn't, because each code, each letter represents the anatomical structures. P, peritoneum. And if the lesion is small, it's a P1. So we describe all lesions together smaller than 3 centimeters in a sum is a P1. And if the lesion is bigger, larger than 7 centimeters, then it's a P3. Hashtag Enzian P3. The same with the ovary. We describe ovarian endometriomas, and we add all lesions. We make a sum of all lesions. And according to the diameter of this sum, we have O1, O2, and O3. And what is important, we classify it separately on the left and right side. And if the ovary is not there, it was removed, then we make an M. Or if we cannot identify it because of adhesions, we classify an X. We can use the ultrasound or the surgical intervention. For the tubo-ovarian endometriosis, we describe adhesions between the ovary and the uterus and the bowel. And according to the extent of the adhesions, we have a T1, T2, and 3. And we also classify separately left side and right side. Here you can see adhesions between the pelvic side wall and the bowel and the uterus, and on the right side you can see adhesions between the bowel, between the ovary and the uterus. And you can see all the same in the ultrasound. You see here the ovary sticks to the uterus. So this is a lesion, a T2 lesion. Sliding effect negative, identified preoperatively. T2 on this side. So the first case, you can see ovarian endometriosis, peritoneal lesions between 3 and 7 centimeters is a P2, O1, small endometrioma, and adhesion between the pelvic side wall and the ovary. The final classification is Enzian P2, O1, T1. For adenomyosis, we have also the possibility to identify by ultrasound. This is a deep adenomyosis, which was also identified by surgery. So we have a hashtag Enzian FA for adenomyosis. We use the hashtag the U for ultrasound assessment, M for MRI assessment, S for surgical assessment. The case here, nodule on the uterus sacral. It's the size 3.2. It's a B3 lesion on the right side. You see here on the left side, uterus sacral B0, no lesion. There is also the lesion in the rectal wall. The size is 1.5 centimeters. It's a C2. So the code is B0 left, 3 on the right side, and C2 for the rectum. We can also classify the uterus sacral or the cardinal ligament by ultrasound. And you can see here, this is the uterus, and this here is the uterus sacral ligament, very thick. And you can see here, this is the lesion on the uterus sacral, 2.2 centimeters. It's a B02 on the right side. Another patient with a lesion here, the rectum and the nodule on the rectum. This is the uterus sacral ligament. You can see here the nodule on the rectum here and on the uterus sacral. So uterus sacral, B lesion, and rectum C lesion. Very easy. Another patient, you can see the ultrasound of the uterus sacral ligament here and the dilated ureter because of the deep lesion. And with the ultrasound, you can see also the peristalsis of the ureter. And in the longitudinal sagittal section, you can see here the dilated ureter. So you have the uterine sacral ligament B lesion and the ureter FU. We resected the segment of the ureter, and this is the final code, B2 and FU. This is the case I showed already, the adenomyosis. And we use the hashtag Enzian classification also during MRI. Typical lesion on the uterus sacral, smaller than 1 centimeter. It's a B1 on the left side, on the right side, nothing. Here, the big lesion on the rectum, it's the C3 lesion, and the adenomyosis in the uterus. So very clear in the MRI, you can see here the hashtag Enzian B1 C3 FA. It has also demonstrated using the classification for deep endometriosis with MRI, there's a correlation between the Enzian findings and the operating time with this classification system. Let's have a look at the code again. S stands for surgery, P for peritoneum, O for ovary, left, right ovary, T for tubovarian adhesions, left, right, and you can also classify the tubal patency. Minus is negative, plus means tube is open. So the right tube is open, no adhesions. The left next a lot of adhesions, and the tube is blocked. Now, the B compartments for the uterosacral ligament on the left side. And how about the rectum? It was not accessible. Then you have to classify an X. And for diaphragma, you give an F diaphragm. The idea of the new classification is also that we combine the findings of ultrasound and surgery. In this case, for example, the ultrasound was done before surgery. You have the same code, but what you can see here is that we can identify the lesion on the rectum, rectal endometriosis more than 1 centimeter, with a U identified by ultrasound. And the same for adenomyosis, which was not visible and clear during surgery. Then you have adenomyosis. It's a substrate U, and it's optional code for the ultrasound finding. The Enzian classification for deep endometriosis has been investigated already, and it's clear that we can assess deep endometriosis completely. It correlates now with the findings in ultrasound, and it correlates with the symptoms, and we have a correlation with the OR time and complication rate. I show you one special case. I do always these sketches when I do the ultrasound investigation, and you can see here, patient with a bladder endometriosis was visible in ultrasound here, and also during surgery, cystoscopy. The adenomyosis nodule was identified by ultrasound and also by surgery. On the rectum, you see here a deep nodule here in the rectum was visible in ultrasound, but there was another nodule in the sigmoid higher up here identified by ultrasound. And during surgery and having removed the nodule or the bowel segment, you can see here, this is the open bowel with the thick nodule on the rectum. This is this nodule here, and the nodule here in the sigmoid. It was also clear correlation between the ultrasound and the ovarian findings during surgery. And this patient has got a nodule in the regio inguinalis on the right side with a nodule which was visible in ultrasound and which was removed by the surgical intervention. So this was the finding by ultrasound and surgery, and it's clear where are all these various lesions located. Very clear to identify. This patient has got a MRI before surgery, and you can see here in this demonstration that the ovarian endometriosis was clear to see. It's an O2 between 3 and 7 centimeters in sum. There is a nodule in the rectum, which was visible also in ultrasound, but you can see here the big nodule in the rectum. It's a C2 lesion. There was the adenomyosis and the endometriosis in the bladder. FA adenomyosis, FB, F for the bladder. The nodule here in the sigmoid is called FI for intestinal. And finally, the nodule in the regio inguinalis on the right side was also identified by MRI. So you have the very, very similar or the same code using the MRI. It has been shown that The Enzian classification does not correlate at all with symptoms, but using the Enzian classification with the different localization, there is a correlation according to the findings. There's also a close correlation between the Enzian ultrasound findings and the surgical findings. And now this is the first paper using the hashtag Enzian classification, which is now accepted by the journal. And it shows that there is a very high sensitivity and specificity with the hashtag Enzian classification using ultrasound and the surgical intervention. This was done by the group of Mario Malzoni and Alessandra Di Giovanni. Now, with this very detailed classification, you can also calculate complication. For example, here, this data from Horace Roman with the bowel endometriosis. These bowel endometriosis are classified with the C1, C2, C3. This is for the rectal lesions. And you see, using this classification, you have a correlation to the operative time or the complication rate, which is very important for the consulting of the patient. And another group showed that if you combine different factors as the Enzian risk group and the age of the patient and previous surgery in a calculation module with points, and when you add all these points and you go into this scale, you can calculate also the risk for a complication in this surgery, which is very important. And we have also seen that there is a correlation between the number of affected Enzian compartments and the symptoms, which is very interesting. And finally, I want to focus on this very important information published by the Dutch group with Metzemaker. And they compared the different classification systems. It was compared the Enzian classification, the EFI, and the Enzian. And there were 40 specialists who classified virtual cases with the different classification systems by paper or by a new computer system. This computer system is called EQUSUM. And it was very interesting that using the paperwork, none of the specialists did the correct classification in the paperwork. And this is very interesting. And now we know that this RSM classification also doesn't respect deep endometriosis. For that reason, we now are at the point that we have to continue to make a complete, comprehensive classification of endometriosis, probably in the future with a computer system. So to conclude, the hashtag Enzian classification is a comprehensive classification. And why we should use it? It improves the counseling of the patient and the planning of the treatment. We can select the most appropriate therapy. We can organize multidisciplinary treatment. And what is very important, with the RSM classification, the data were incomplete. And for this reason, all the scientific work was very difficult. And with this new system, we hope that we get more information about the disease and about the prognosis and the best treatment for the patients. Hashtag Enzian combines ease of use and a very high accuracy to describe endometriosis. And I hope you enjoy this new system. It looks a bit difficult, but as soon as you start using it by ultrasound, MRI, or by surgery, you will find that it makes much more fun to identify and describe the disease completely and very accurately. Thank you very much for the attention.